6 health authority employees are confirmed to have contracted COVID-19. They all work in the recently opened GHA Children's Hub in Europort. The only detail provided by the Deputy Chief Minister was that one of the 6 had been admitted to hospital, with the other 5 recovering at home, adding that Health Minister Paul Balvan will explain further at Thursday's press conference. However, GBC understands that the outbreak has had a wider effect than just those confirmed to have been infected, with up to 24 staff members, including 4 doctors, in self-isolation. The Children's Hub, which is currently also being used as an emergency outpatients unit and GP clinic, as well as for children's vaccines, is being decontaminated. The outbreak is significant, as it has occurred at a time when the general statistics for Gibraltar are showing stability in the rate of infection. 5.5% of the population has been tested, with 1,753 swabs taken. This has resulted in 131 confirmed cases of COVID-19, 26 of whom remain active. There are 4 further suspected cases in hospital, 2 of whom are in ICU. But generally, the virus is being kept at bay, with the number of people in self-isolation down and also fewer people calling 111. Nevertheless, the government remains alert to the very real possibility of a surge, for which we must not let down our guard.
This war is far from over, and now is not a time to take risks, because that would be irresponsible. It would mean taking risk with your safety and ultimately with your lives, and we are not prepared to do that. Exit from lockdown is now at the centre of the discussion, at a global level, and also in Gibraltar as well.
The recent cases at the residences for the elderly have now fully recovered. Random testing continues at Mount Alvernia, John Mackintosh Wing, Hillside and Bella Vista to identify any infections that may not be manifesting with symptoms. Geriatrician Dr. Antonio Marin revealed that the ERS's medical team had been strengthened with an additional doctor, and non-invasive ventilation equipment has also been acquired should it become necessary. But in respect of the lockdown for the over 70s, he defended the policy and recommended that despite being at home, the elderly should remain as active as possible.
Releasing people going out for a walk, that will be very difficult to maintain the social distancing. That's one of the problems. And at the moment, we need to evaluate risks and benefits. And obviously, the risk of getting an infection from COVID-19 is far greater than the risk of not doing any physical activity. But we do recommend people to go into YouTube and have a look at the GHA video that our physiotherapy colleague have made to do some exercise at home. My advice will be drinking plenty of fluid, moving the legs, keep the legs elevating to prevent thrombosis, and try to do a healthy eating and try to avoid any high-calorie products.
The pandemic has reshaped our lives, but despite the latest cases at the GHA, there are also encouraging signs. As Dr. Garcia put it, a glimmer of light after weeks of darkness. Exit from lockdown is now very much on the discussion table, but for the moment, Gibraltar is sticking to the plan.